Happy to have you all with us today for another edition of our Expert Chats. I'm really excited about this topic today. It's been making headlines. Likely you've heard about it. We're talking about convalescent plasma therapies. And today we're joined by two men who are really on the front lines of getting this treatment to West Texas and to Texas Tech University Health Sciences Center, Dr. Mark Sigler and Dr. Thomas Hale. Hello to you both. Thanks for being with us.
Thanks, Megan.
So before we get into the weeds of the treatment, I want to hear about your roles at Texas Tech University Health Sciences Center. Dr. Hale, let's start with you.
I'm the director of the clinical research unit here at Texas Tech, and my job is to make sure we facilitate research projects and help faculty get projects underway, make sure they're done correctly, make sure they don't get in trouble when they don't get consent forms and things like that. So it's all about prospering and helping faculty with research projects. I also run the Infant Risk Center, which is a center of excellence here at Texas Tech, and it's a worldwide call center for drugs in pregnancy and breastfeeding. And so I also run that center.
A lot of people very familiar with your work with the Infant Risk Center, a wonderful program indeed. Dr. Sigler, you're new to Texas Tech. Let's talk about what you do for us.
Yes, I've been in Amarillo for about 4 years now. I did my fellowship training at Texas Tech in Lubbock and moved to Texas Tech in Amarillo just over a month or so ago. And so I'm now teaching faculty with Texas Tech. And my teaching roles are primarily with pulmonology and critical care. So lungs, meaning things like COPD and asthma in the clinic. And then critical care, meaning patients that are critically ill and in the intensive care unit in the hospital. We do quite a bit of teaching with the medical students, and one of the areas that's been very important to us recently has been how do we take care of critically ill patients in the intensive care unit that have this new disease, COVID.
And so I'll stick with you for this first question. This whole idea of convalescent plasma therapy has been around for a while. They've used it as a treatment for other diseases, other viruses. Can you kind of explain to us what it is and how it's impacting COVID-19?
Sure, you're right. Convalescent plasma has been around for years now. It's been evaluated in other conditions, largely viral conditions, things like influenza or even like cousins of coronavirus. And it's been found to be effective in some patients that have received it. What convalescent plasma therapy really means is we take plasma, meaning the fluid component of the blood that has some proteins in it, from a patient that has had this disease and recovered. Usually it's patients that have had it about a month or so ago, and oftentimes were very sick when they had it, but then they survived. And part of their ability to survive the infection is their body creates antibodies or proteins that attack the virus. And that is one of the important things that your body does to help you survive viral infections such as this. Once you have those antibodies or proteins, that helps to keep you protected from having infection again. On the other hand, if you've never had the infection, you develop it for the first time, you don't have those antibodies or proteins because you have not yet been exposed to the virus. And so our hope is that if we take plasma, which has those protective antibodies and proteins that target the virus, and we give it to someone that doesn't have those antibodies or proteins, our hope is that it will help their body to fight the virus off and help them to survive.
So getting this as a treatment for COVID-19 was a bit of a process, right, Dr. Hale? And I really want to talk to you about how we became involved with this Mayo Clinic study and how we got it implemented very quickly in the Amarillo area.
Well, I got an email about a week or so ago from Dr. Burke, the dean of this School of Medicine, and he had appointed Dr. Siddiqui in Lubbock and myself here in Amarillo to try to kind of shepherd this project, this research project along. And then Dr. Sigler gave us a protocol, an IND-like protocol. So I decided the very first thing you have to do to get any kind of like project like this underway is you have to go through the Food and Drug Administration. So I contacted the Food and Drug Administration and said, where do I submit this IND and what form is it supposed to be submitted in? Because I've done this before, and I know that if you sometimes it'll go up there and it gets lost. And so I knew to ahead, look, make sure we were doing it the right way ahead. And a young lady from the IND said, you know, this protocol is identical to the one in the Mayo Clinic that's underway. And we've just approved the Mayo Clinic protocol about a week before. And she said, you guys ought to just join with that group up there. And so I said, well, that sounds interesting. So I went to the Mayo Clinic site and found it, found the protocol and everything. And then because I've done this before, I know I have a number of expert people that work with me. And so I called Kathy Thomas up from the Institutional Review Board here. She instrumental in that board. And I said, all right, how do we get this thing going? And can we get the entire protocol and the IND application and everything? So she actually called the Institutional Review Board at the Mayo Clinic. And they gave her copies of the protocol and everything and told us exactly how to do it. And that was then, that was about, I guess, 10 hours after we started. And then I asked my director of the clinical research unit, Patty Price and Kathy Thomas, to get this thing ready, get it submitted to our institutional review board, make sure the consent form was right and everything. And these two are they're expert at this. They really know how to do it. And I'm telling you, within 12 to 14 hours, they had gotten this thing all done. It was all almost completely done. And so I looked at everything and made sure that it looks okay to me. And Dr. Siddiqui and I confirmed back and forth on this a number of times. And then it was submitted to the Institutional Review Board. It was instantly approved by our IRB board. And all of a sudden, the project was done in about 2 days, I guess. And then Dr. Siegler was given the next task, trying to find convalescent plasma. So that's kind of what we did. We just did what we know how to do, and we did it very quickly. And it worked really well because I had two people that are just super at this.
I think it's really fascinating that both of you have been working so hard on this project, but you've never met, even though you're both in Amarillo. I think that's so neat that we have a system in place and we have experts on hand to make sure that this sort of thing can happen, and it can happen quickly, to make sure that patients get excellent care, but also that we're sort of on the cutting edge of research right here in Amarillo. That makes you feel good, don't you think, Dr. Hale?
Yeah, the reason we were able to do this is because we're an academic medical center. We do these sorts of projects often. We've had hundreds and hundreds of research projects go through the clinical research unit here in Amarillo, and we know how to do this. And you don't find that out anywhere else. And so the fact that we had the medical school here in Amarillo, we had all these centers, we had all these people working for us that know how to do this, we just went into high gear, and it just came to fruition literally in about 48 hours. We were ready to go and to start consenting patients. So it came about because we have this structure here in the medical school, and you won't find that in any other places than medical school environments, where we have a built-in infrastructure, and that's what we do.
I think that's really fascinating, and that goes straight into the impact that it has on patients. Dr. Siegler, I mean, you treated your first patient on April 12th, and that we won't get into the specifics of all of that treatment, but things are looking good at both BSA and at Northwest Texas. Can you kind of give us your impression of this treatment?
Yes, I think that we have seen early positive results from this treatment. I think we still need to carefully assess, especially over the next few weeks and the next few months, how our patients are responding to it. I think it's important to be cautious in how we interpret our results too. Sometimes when we see a new disease like COVID, we're tempted to look for the silver bullet, kind of like the magical cure that we give this and patients are magically better the next day. And I don't think we're going to find a medication like that. But what we do want to find, and what's really important for us to evaluate, is can we identify treatments that will help these patients to recover, and to recover likely slowly in many cases. And if we can identify a treatment like convalescent plasma or another treatment to do that, then I think we'll be able to consider ourselves successful. But we do have to be very careful in how we evaluate that. And so far, we have seen early positive results.
And part of this is getting a supply of this convalescent plasma. And that takes coordination with the hospitals, with medical practitioners, with blood banks as well, right? How can people donate? How long do they have to wait before what are sort of the specifics about that, Dr. Sigler?
So we have been working closely with the Coffee Memorial Blood Center, who's really the hub for convalescent plasma donation. And Todd Bell and Scott Milton have been working closely to coordinate this donation process. And it is important to be able to obtain blood locally. And the best way to do that is by contacting the Coffee Memorial Blood Center or the Department of Health, and they should be able to direct most patients that have had COVID and have recovered from it, usually over about 2 to 4 weeks after their recovery, and should be able to direct them into their next steps if they're wanting to consider plasma donation. We've been very happy here. We've had a number of generous donors already that have really been helpful for us in being able to obtain plasma locally. The reason why it's important to obtain plasma locally is that when we enroll a patient in a trial, we don't want to wait 4 days for the treatment to begin. And so it's been important for us to see the community really come together to allow us to treat patients very quickly. Many of our patients that have been enrolled in this trial have received plasma within hours of being enrolled now. And that's very difficult to do. And it's really a credit to the local community to what they have been willing to do.
That's really, really amazing. I'm so inspired by the work that both of you have been doing on this project. It's really incredible. And I think this is a great opportunity for the community to reach out and really, people are always saying, how can I help? What can I do? Well, those who have been infected with COVID now can literally go and help their fellow neighbors get through this. And I think that's a really cool thing as well. So thank you guys so much for sharing today. We're going to do something now that I think is also really valuable. We're going to play a lightning round, okay? Dr. Hale, are you ready? Are you ready for the lightning round?
For the lightning rounds?
Yes, sir. Here we go. The first question's coming at you now. These questions are difficult. You might have to think about it a little bit, but just answer from your gut, okay?
Okay.
Okay, first question, Dr. Hale, crunchy or smooth?
Crunchies or smoothies? Well, I'd go with
Crunchy or smooth?
Smooth.
Smooth, Dr. Sigler?
Crunchy, no question.
Really? Wow, interesting. Okay, favorite ice cream flavor? We're coming at you, Dr. Sigler, first.
Dark chocolate.
Okay, simple. Dr. Hale?
Chocolate as well.
Well, there you go. You have something in common. Okay, pineapple on your pizza or no? Is that a violation?
No way.
All right, Dr. Sigler, what do you think?
No, they should have laws against things like that.
I love that. Okay, first concert you ever attended, Dr. Sigler?
It was actually one of my friends in medical school, Kip Slicker. He had a band and put on a concert in Tulsa at the old Cain's Ballroom.
I love Cain's Ballroom. So good.
Yes.
Dr. Hale, are you an avid concert goer?
Not particularly. I did when I was younger, and now I'm beginning to show my age. My first big concert was to go see the great jazz band Count Basie. He was in Oklahoma City. It was the last few years he was playing. He was fabulous.
Wow, that's awesome. Both of you attended your first concerts in Oklahoma, so that's an interesting thing too.
Oh.
Okay, last question. Now, recently, Dr. Fauci was asked if anyone could play him in a movie, who would it be? He chose Brad Pitt. So if you guys were involved in some sort of medical drama a la Grey's Anatomy or something like that, Dr. Hale, what famous actor would you want to play you?
Oh, Brad Pitt would be all right. That'd be fine. Perhaps someone a little bit more distinguished, and I'm not quite sure who that would be. I wouldn't care, really.
We'll let you think on it. How about you, Dr. Sigler? Who is your actor?
Well, I guess I would settle for Brad Pitt as well if I had to. I don't know if actor, but I've gotten the Michael Phelps comparison many times. This was more common, 10 years or so ago, 10 to 12 years ago. So I guess it wouldn't necessarily be an actor, but if I needed a stand-in, that's probably, I guess, who would go.
100%. I knew you were familiar. Well, now I've figured it all out. Well, guys, thank you so much for talking with us today. Again, we really appreciate you taking some time. We know that you're very busy, and we really, really appreciate the work that you're doing. Thanks for being with us.
Thank you for having us.
Okay, you bet. Thank you.
Tom, it was nice to meet you. Hopefully we meet in person once all this dies down.